Hello, my wonderful CATAMANIA listeners. If you've been following me for a while, you are probably aware that I have set a set of slogans that have taken off that many of you really love. Some of them have become some serious beliefs and even missions. Like, for example, if something doesn't fit within your budget, I believe that you should just increase the budget. That a true dream job is to be a manager of husband's bank accounts. Now, some of these slogans have become serious missions. Like, for example, that we must resuscitate chivalry. Now, if you want to join me on any of these missions, or if you simply vibe with any of my slogans, you can now purchase my merch at mbhtv.com/collections/CATAMANIA. You also have a chance to win $5,000 if you purchase any of the pieces between now and end of July. The winner will be announced on my Instagram on July 29th. Good luck.
I'm always amazed after everything that we do surgically in the recovery room. They're moving their face, smiling, laughing like nothing happened. I always look at them and I'm like, you got in a knife fight with me and you lost. One of my cheesy lines is you always want to put out smoke before it becomes a fire. So I want them to call me when they start seeing a little bit of smoke. What are red flags for doctors? Anybody who tells you like nothing ever goes wrong. You paint enough walls, you're going to get a little paint on the floor.
Welcome to this week's CATAMANIA episode. I am sitting down today with Dr. Miguel Mascaro, who is a board-certified facial plastic surgeon. Welcome to CATAMANIA.
Well, thank you for having me.
People are very, very interested in plastic surgery. Has that been the case before social media?
I mean, I hate to say it, but I was literally with my 8-year-old niece and she's asking me about skincare routines. Why? Because she's seeing it on TikTok. Not everybody can look the same. Not everybody has the same bone structure. You have to embrace your own aesthetic and embrace what makes you, you. It's not about making things better. It's about subtracting the things that take away from your natural beauty.
Hello, my wonderful listeners, and welcome to this week's CATAMANIA episode. I am sitting down today with Dr. Miguel Mascaro, who is a board-certified facial plastic surgeon. So that's actually all I'm going to say because I know that you're going to enjoy this one. I know that this kind of conversation, this kind of topic is always of interest to you. I really love how you're directing the questions to me as if I know something. I only know what I get done. So I might as well sit in a conversation with somebody who really knows everything about that and all the procedures and stuff like that. So we'll touch on, you know, as much as we can.
I don't know about everything, Cristina. I know you said
you don't know everything.
I know you said I know everything. I'll try.
More than me. Let's put it that way.
I know more than you. Yeah, definitely.
You know more than me.
Hopefully.
So, welcome to CATAMANIA.
Thank you. Thank you for having me. I appreciate it.
Yeah, it's nice to have you. I'm excited. The subject of the truth is objective truth. For whatever reason, for the past few years, I've noticed ever since like doing social media work, people are very, very interested in plastic surgery. Has that been the case before social media? Has like the world of social media influenced that at all?
100%. I mean, I think that there was always an interest, but it was more hush hush. It was never so widely accepted. And so I think that the one thing that social media has done is it's made it so that it's easy for us to talk about this. It used to be one of those things that, you know, if I would go to a party, you know, people would say, oh, by the way, Miguel's a facial plastic surgeon. You may want to talk to him. And then they pull me aside and they go, oh my God, so I was thinking about this. What do you think? Now it's just wide open. Everybody's openly discussing it. I mean, I hate to say it, but I was literally with my 8-year-old niece this past weekend and she's asking me about skincare routines. We're talking about 8-year-olds. Why? Because she's seeing it on TikTok. She's seeing it on her social media. And not that I'm condoning this and I'm saying this is a good thing, but it's just pushed that line and that envelope that much further along. And so now you have both the good and the bad that comes with it. Good in that it's much more open. We have more people talking about it. So there's not as much
Like stigma?
Yeah, and you know, the big thing is people often will kind of dig their heels in with one particular thing and say, oh my goodness, you have to do this, you have to do this, you have to do this. When in reality, there's 1,000 different ways to make chocolate chip cookies, and every chocolate chip cookie is going to taste pretty good. So it doesn't mean that you can just do it one way. So that's the one good thing about it, is that it's opened up the world for discussion. Bad thing is you've got 8-year-olds that are doing skincare routines and spending hundreds of dollars at Sephora.
That's kind of terrifying, actually.
It's scary. It's scary to think about. But I mean, anybody who's, kind of been on TikTok enough or been on YouTube enough or has kids, you can hear them start to talk about it. And it's a little scary. It's a little weird. And that's where, parenting comes into play a little bit.
Right. You were telling me before the recording, and I really want to know, what's your background? So you told me you're from Ecuador.
So I was born and raised in Ecuador. My family's originally from Spain. They're actually from a region called Catalonia. So technically not Spanish, but Catalan.
Catalan, yeah, that's right.
And so my grandfather actually fled the country during the time of Franco. They took all his stuff, like any other good Catalan independentist, and they took all his stuff, and he fled to Ecuador. And that's where my dad was born, and that's where I was born. I lived there till I was 14 years old. And then I went to high school in Virginia. Was in Northern Virginia, which was not at all what I was expecting, right? Because growing up in South America, going to the United States was basically you come to Miami. Like for anybody growing up in South America, United States is Miami. And so when I moved,
Spanish is like the second.
Yeah. So when I
if
moved,
not most widely
most
spoken,
people,
most people speak Spanish.
And so when I went to Virginia, I think this is not Miami. Like this is not Miami at all. And you get used to it. It's cute. It's quaint. It's got its good things. I went to college in New York. Did my medical school in New York, did my training in New York. And then like every other person who's in New York, eventually you get tired of New York. And as much as you love it and you drink the Kool-Aid when you're there, I went and did my facial training in Alabama. And I was thinking about going back up to New York because, you kind of get the bug that, you have to go back to New York. Everybody goes to New York. You kind of drink the Kool-Aid when you're there. It's amazing when you're there. But then you leave and you realize, wow, I can go shopping and I can buy groceries without having to worry about what I'm carrying back to my apartment. Although now you can get it delivered, but back then you still have to carry your groceries. And we're looking around with my wife and we're thinking, well, we like the beach. So let's look at places that are warm, that have beach. And my wife's an emergency room doctor. So I told her, wherever you get a job, I'll follow. And so she got a job down in Miami. And
an emergency room doctor.
Yeah, she's a real doctor.
Whoa.
Yeah, she's a real doctor.
The stress levels that woman can endure.
She saves lives.
Wow.
Yeah. Whenever there's emergencies, if we're on a plane and they ask for a doctor, I put my headphones on and I tell them, you go save them. I'll be here.
I have a friend who does that. It's like, wow. Yeah.
It's totally different, and it's stress on different levels. And we were talking about this off camera about the stress that physicians have at their jobs. And so you're telling me a little bit about your family and kind of like the stress that, your exposure to family stress from a physician standpoint, since there's physicians on the family side. And my stress is totally different than my wife's stress. And so I could never go to the emergency room. I get just reflux thinking about being in an emergency department. And the same goes for her when she comes into my office and she sees, the patients that I deal with, how, what I have to contend with and like the details that I'm stressing about. She immediately thinks like, I could never worry about that. But for me, it's all about details. And so when I come in and I see that, one of the lights is slightly different color on the fluorescence on the roof than the other ones, I freak out and I immediately start telling people, you need to get John, who's our office manager, who kind of takes care of all the lights and fixtures and cleans everything up for us. I'm like, you need to get him in here right away. We need to change this light. The color's not right. It's off the white balance. The K's wrong. So she's like, why are you stressing so much about this? And I was like, because it matters. It's like all those little details. Whereas she's got, someone who's in a diabetic ketoacidosis and she's got to actually figure it out before they go up to the ICU. So it's very, very different.
Very different. What made you choose? Did you always know that you wanted to embark on the plastic surgery?
No, not at all. So I wanted to be a neurosurgeon. I was originally a philosophy and neurobiology major in college. And so to me, the brain was always fascinating. And in philosophy, I was an epistemology major. So within philosophy, I was an epistemology major, which means that you are in the quest of knowledge. So it's the study of knowledge. And neurobiology, I was doing mostly modern neurobiology. So it was environmental and developmental. So they both kind of went hand in hand. It was interesting. And I got into med school. And then I was like, I'm going to do, neurosurgery. I want to do the brain. Can we curse?
Yeah,
Yeah.
absolutely.
Okay.
You can say whatever.
So,
Are there any subjects off
okay.
limits? I forgot to ask you
No,
before.
I don't
Okay.
give a shit.
Okay. Amazing.
So that's why I said, fuck it. I'm going to be a doctor, and I'm going to be a neurosurgeon. And so I got good grades because that's what you do if you're going to be a neurosurgeon.
Yeah.
And then I went to do research between first and second year because that's what you do if you're going to be a neurosurgeon. I'm not kidding you. 3 days in the neurosurgery lab, I wanted to kill myself. I could not see how I would ever do this for a living. And then at that point, it was confusing, right? Because my whole life, I thought, well, kind of wanted to be a neurosurgeon. And now I'm in it, and it's not at all what I expected in any way whatsoever. Not from the surgical standpoint, patient care standpoint, lifestyle, you name it. There's not one box that in my mind was checked off. I mean, it was crushing, really. And so then I realized, well, what can I do? And I knew I wanted to do something surgical. The idea of just traditional medicine did not appeal to me. I liked the idea of fixing things, right? I was always a little kid that liked to take stuff apart, put it back together. And so the idea of removing pathology and fixing it was really appealing to me. So then I'm like, okay, well, let's go through the check boxes. All right, so general surgery, not for me. Don't like it. Cardiothoracic, love it, but lifestyle, not so good. Ugh, I don't know if I can do this. Check that off. Urology, cool, but I don't want to play with penises all day. Check that off. And so I'm just slowly knocking everything off.
Right.
And eventually I scrubbed into a rhinoplasty. I thought it was the coolest thing I've ever seen. And in my mind, it was very much what my idea of surgery was. Details, making sure you're taking into account position, lighting, millimeters matter, how you throw a stitch, where you put it, how it's done. It all comes into play. And I think it harkened back to when I was very little. I was in sports originally. And so I played a ton of sports growing up. It busted my knee, crushed my dreams of professional sports, at least in my mind anyway. But I also did a lot of art, and I did a lot of sculpture growing up. And so my mom had always had me in art classes, and I was always painting, I was always doing sculpting. And it kind of brought that back, and it made a lot of sense to me. And so then at that point, I was like, okay, I want to do plastics. I want to do facial plastics specifically because it was so detail-oriented. So I'm like, I want to focus on the face. And then that neurosurgical aspect came out, and I was like, nah, I want to do reconstructive. I want to do like big skull-based reconstruction. So in my training program, we did a lot of trauma. We did a lot of skull-based reconstructions. Hated it. So I did a couple skull-based, and I was like, I cannot do these big cancer reconstructions. They're just not for me. Like the things that I liked were like the detail work. I really enjoyed making sure that things were sitting right, the aesthetics of it, how things functioned right, making sure that when someone came in and walked in, they left looking, feeling better. So the combination of both really mattered to me. And what I noticed was when we would hang out with our cosmetic facial plastic surgeons, the relationships they had with their patients was much more in tune with what I was hoping for, which is much more of a working relationship rather than I hate to break it to you, you have X, Y, or Z disease. We have to do X, Y, or Z big flap. It's going to, take this part of your leg. We're going to put it over here. We're going to reconstruct. And yet the surgery was cool, actually doing it, but I didn't feel satisfied in the outcome cosmetically. I didn't feel satisfied in the outcome functionally. And so I do feel that both of them have to go hand in hand. So I didn't really love it. And then at that point I realized, well, I think that what I really like is cosmetics. So I started hanging out a little bit more with my cosmetic surgeons. And then they recommended to me, said, Miguel, well, if you're really interested in this, don't just hang out with me. Go see what everybody else does, right? If you like cooking, don't just hang out with one cook. Go hang out with other chefs. See what exactly excites you. See what you like. Pick up little different things from everybody else. And so I started shadowing a bunch of people. And that's one of the great benefits of being in New York. And I was very, very lucky of being in New York. So I was able to ring up a couple really famous guys, a couple of guys before they were famous, and they opened the doors. And this was back before they were charging thousands of dollars for someone to spend a day with them. I would just hop on my buggy and go up to their office and just spend the day with them. They teach me here little things. And I still have a little black moleskin book where I was like taking notes on how to do little things left and right. And I figured out this is what I really like. And then just kind of went to cosmetics.
I really do love the relationship that people have with their plastic surgeons, because it's like you leave so happy afterwards, because you're like,
Well, it's totally
I love
different.
myself. I'm gonna get canceled for this, but I don't care. It's like I love myself even more. My levels of confidence increase, and like this is the person who did it. That's how I feel about my plastic surgeons, honestly.
It's like kind of like dating. And what I tell my patients is, particularly during a consult, I'm lucky enough where the wait time to see me is super long. So when people wait that long to see me, I know they're going to come and they're going to do surgery or whatever I recommend, because my aesthetic is pretty clear. And so they already kind of know what it is that they like, what it is that they don't like, what they want, what they don't want. It's just a matter of seeing if we click. Right? And so the first 5, 6, 7 minutes, we're just bullshitting. We're just hanging out.
Yeah.
We're figuring out if we have a good vibe.
Right.
Because most of the time, it's going to go great. 99 times out of 100, it's going to be perfect. You're going to love it. The thing you have to be aware of is things happen. Sometimes you get bruises on your lips when you get lip filler, right? Sometimes, you might get a little
when you were
scar.
supposed to be recording
When you're
podcasts.
supposed to record a podcast, you might get, so there's little things that happen, and how that office responds to you, how your doctor responds to you is just as important as if everything was perfect. Because sometimes they may have to do little things here and there to fix it. And you want to make sure that they're going to be there for you. Mm-hmm. So to me, it's important to know that not only I'm going to be there for them, because I will do that for any one of my patients. My patients have my personal cell phone number. If any questions, they just text me or call me. It's not at all, not a problem whatsoever. Mm-hmm. However, I do want to know that when they call me and they reach out to me, that we have that open line of conversation. And so that is important to me, because I want them to know that they feel comfortable, able to just say, hey, Miguel, this is what's going on. What can we do about it? One of my cheesy lines is, you always want to put out smoke before it becomes a fire. So I want them to call me when they start seeing a little bit of smoke. I'd rather you call me with a stupid question or send me a stupid text than wait until the end. And why did you wait so long? Like, then you feel bad. Then the patient feels bad. And they feel like, oh my God, did I do something wrong? I should have said something earlier. And it breaks down that relationship a little bit. And again, it's like dating. So communication, super important. Whether it's with your spouse, your boyfriend, your girlfriend, whoever, your doctor, really, really, really important.
Have you had instances where things have gone a little bit
Of course.
sideways?
Yeah, always.
Do you mind sharing?
Yeah, no, of course. Listen, if you go, biggest red flags, I tell for anybody who's, and this is a common question, is what are red flags for doctors? Anybody who's got like perfect reviews, or anybody who tells you like nothing ever goes wrong. You do enough of this, something's going to happen.
Right.
You paint enough walls, you're going to get a little paint on the floor. It's going to happen no matter what. So you name it. I mean, I do about 500 lip surgeries a year, and I'm due about 200 facelifts a year. So, I mean, you name any sort of weird thing, I've
They look
seen
really
it,
great,
and
by
it
the way.
and it's happened. Well,
Yeah.
Thank you. And it happens. So, for example, this one comes to mind. So it was maybe about a year and a half ago, facelift, straightforward. 48, 49, good looking, great bone work. This is like easy home run. Like relatively well-trained monkey could make this person look incredible. Like this is going to be easy, right? You're thinking this is going to be amazing. I'm going to have incredible before and after. This is good. We do a facelift. Things are going great. Day one goes well. Day two goes well. What is the biggest risk in a facelift surgery? So if we were playing, I don't know, if we were playing any sort of trivia game, hit the bell, immediately raise your hand. You say top 5 things that can go wrong: fluid collection, fluid collection, fluid collection, fluid collection, fluid collection. Right. Usually after the first day or two, that risk is gone.
So what does that exactly mean, the fluid collection?
So when you're lifting the face,
Yeah.
you lift the skin off the muscle and the muscle off the deep lying tissue. So you're creating 2 potential spaces. So once everything's healing back up, not only are you does the skin have to adhere to the muscle has to adhere to deep lying tissue, you also need to make sure that that space closes, because you created a space. And so the body's going to try to fill that space. So it'll fill it with fluid traditionally, but what we don't want is to fill it up with blood, right? Because blood can keep pumping. So we have what are called arteries and veins. And so if one of those little guys is open, then what'll happen is it'll just keep filling that space up with fluid. If it continues to fill that space up with blood, then two things will happen. One, eventually the pressure is so much that it'll stop bleeding, right? Almost like you're holding, if you're bleeding anywhere and you just pulled a little pressure, your body will hold pressure on it, it'll stop it. If that happens, you get scarring, you need injections, you need a bunch of stuff to kind of get it to heal up. It's a pain in the butt, but guess what? You'll be okay.
Right.
What we're worried about is what's called an expanding hematoma. That's when the artery's a little bit too strong and it'll just keep pumping and expanding and getting bigger and bigger. And so that space that you've created doesn't seal up. So those can be life-threatening. Those can be dangerous. And those are very rare, very rare. If you look at fluid collections across the board, 1%, so 1 in 100. So you do enough of these, you'll get 2, 3, 4 a year. You know, it's nothing crazy, nothing dangerous. Life-threatening ones, usually 1% of 1%. It's pretty rare. And so this lady, and when they do happen, they happen within the first 24 hours, you know, because usually it's a surgical issue. So that means that you didn't cauterize or, you know, some blood vessel opened up after the numbing wears off. It's usually pretty quick early on. Rarely do they happen very late. This lady, 3 days go by, all of a sudden calls me. She goes, hey, my neck is swelling. Usually it's just swelling, nothing to worry about. Right. Send me a picture. She's got a golf ball there. Okay, let's bring you back into the office. I'll take a look at it. It's a Saturday. I'm like, I'm not going to wait till Monday. Let's just take care of it. As she's calling me, she goes, my voice sounds weird. I'm like, what do you mean your voice sounds weird? She calls me, voice sounds muffled. It's an expanding hematoma. So all of a sudden the blood is getting bigger. So she comes in. When she comes in, I mean, her neck is huge, almost like a bullfrog. Rush her up into the operating room, numb her up, clear it up. And the good thing is, as soon as you clear up that blood, pressure goes away, you feel much better. Now, when you do this type of surgery, you're wondering, oh my God, under local anesthesia, that sounds so crazy. Your skin is numb because you separate the skin off the muscle and the muscle off the deep lying tissue. You trim all the little nerves that give sensation to the skin. So you're numb. So she doesn't feel anything. It's not a problem. It's just relieving that pressure. So at that point, you're just thinking, I need to relieve the pressure so that then I can see what's going on. Like most expanding hematomas, what happens? It's not just one spot that's bleeding. It's a lot of little spots that are bleeding. So there's something going on genetically that wasn't picked up on the blood work that had to be dealt with. Cover that up. Guess what happens? 30 minutes later, she's going home. The other side starts bleeding. So now she bring her back in. The other side's bleeding. Had to open up the whole other side. Nightmare scenario out of nowhere. So we ended up cleaning everything up, taking care of her. I saw her every day for a week and making sure everything's okay. I was super paranoid at that point.
Of course.
Long story short, she ended up having to get some blood work, hematology work. They did a full workup. They found tiny little factor that was missing genetically that she never would have known beforehand, and she's never had any issues before. Then she mentioned, you know, by the way, when I had my last couple of surgeries, they did mention I bruised more and I bled a little bit more than usual. Most people say that, but nothing to this extent.
Mean anything,
exactly. Yeah. And that also doesn't mean that just because someone tells you they bruise more, you need to get a full hematologic workup and send them, you know, to see a hematologist and spend thousands of dollars doing this crazy workup. But that's a case where unexpectedly things went wrong. And so you had to hold their hand. They had to trust you. I tell everybody, we're jumping into the deep end of the pool together. You got to trust me that I will teach you how to swim. And so that was one of those cases where we were both sinking and I had to make sure that she swam. And she did great. She did perfect. She sends me more people than anybody else. And she looks incredible.
Probably because you took really good care of her too when this was happening, right?
Absolutely. And that's the thing is you have to be available.
Right.
You know, and I treat folks the way that I like to be treated. And for me, that's super important. And not only for me, but for my staff. So all of my staff, I make them read the book Unreasonable Hospitality. I don't know if anybody who knows this, but if you've ever worked in a restaurant or you've worked doing any sort of service industry, Unreasonable Hospitality has become kind of like the Bible of how you go above and beyond for things. And it chronicles 11 Madison Park and everything they did to go from a two-star brasserie in New York to the best restaurant in the world. And it's very similar to the way that I like to think. I've done everything. I used to clean golf clubs. I make breakfast burritos. Like, you name it, I've done that job. And so to me, the big difference, and this is something that I've talked to one of our mutual friends, Aman, about, is that I don't see myself as being in medicine so much as in hospitality. And
like almost like a service industry aspect to it.
100%.
Yeah. My husband told me that once. He's a lawyer, and he's like, I'm in a service industry. And I'm like, what do you mean you're in service industry? He's like, I'm in service industry. A lot of doctors are in service industry. And I was like, oh, I guess that's true. There's a service that you provide, but you just don't think of it that way, right?
And you have to think of it that way. And when you realize that's what you're doing, it flips the switch on the care you provide for your patients, how you deal with them, how your staff deals with them, because it's not just a one-man show. And one of the things that I tell my patients all the time is that it's not just me, it's everybody. And everybody that's involved in the care, from the person that picks up the phone, person that greets them at the front desk, to the person that's emailing with them nonstop. And so we provide care that I think far exceeds what most people would. And it reflects, my staff gets just as many presents as I do because people just don't expect that level of care or compassion from them. I had a patient of mine who she was supposed to come in. She was supposed to fly in from Switzerland, or actually from the UK. She was supposed to fly in from the UK and had her boyfriend went skiing in Switzerland, had an accident. Tragic. She had to cancel her surgery. She was upset. She didn't want to lose the deposit. I was like, don't worry about that. So what do? I talked to one of my front desk girls and I was like, hey, listen, you heard about so-and-so? They said, yes. I said, I need you to find out where her boyfriend is staying at, what hospital he's at in Switzerland. We're sending them flowers. And she's like, how do I do that? I was like, I don't care. You have till the end of the day. I'm sure they have delivery services in Switzerland for flowers to hospitals. Figure it out. Here's my credit card. Just make it work. 2 hours later, she goes, we sent them, delivered, taken care of. Next day, they send us she sends us a nice little email saying, I can't believe you guys sent us this, took care of this, blah, blah, blah. I'm like, it matters because once we take you in as a patient, you're like family. Right. And so we treat you like family because that's how I would want to be treated.
Right.
And it's about going that extra step.
That's awesome.
It makes a little difference. It's all about that because you're trusting me with way more than something that a lot of people care about. You know, you're trusting me with, I hate to say it, but your vanity, so to speak. And it's kind of what we were talking about earlier where doctors have that life or death pressure. I don't have life or death pressure. Mm-hmm. Some people would say that what I have is higher because it's on your face. Like you can't throw a sweater on it. Mm-hmm. It's not like you're doing a tummy tuck and whatever. Just throw a sweater on, you're good.
Right.
It's on your face.
And you look at it all the time, right?
Looking at it all the time.
Yeah.
You're studying it all the time.
Yeah.
And your margin for error is almost zero.
Right.
So pressure is a privilege, right? We have the privilege of this pressure.
Like so that pressure is a privilege.
Yeah,
like
we
that.
have
in
to.
Every area.
Every area. Absolutely everything. From when they call, how they do everything. And harkens back to what I was telling you. People are waiting 1.5 years to come see me. Guess what? I tell my staff this. Every time you pick up the phone because they're coming to see me or when they see you for the first time, it's the Super Bowl. Mm-hmm. It's the fucking Super Bowl. Every single patient, everything has to be perfect because it matters to them, right? Because they've waited so long. They have this idea. They're finally coming in here. Like, it doesn't matter they're coming in to see me. They're seeing you first.
Right.
And they're talking to you. So it's the Super Bowl for you as much as it is for me. And I realized that my staff kind of got it when they stopped referring him as your patient or the facelift. They would say our facelift or our patient from blobbity blobbity. So once they start taking ownership in it, that's when I'm like, okay, they get
So you've
it.
done something right from a business perspective there too, to build that attitude and relationship, to instill that in your staff as well, right?
Yeah,
They think of
absolutely.
it as our business in a way, right? It's,
Right.
Yeah.
So when people take ownership of things, they care.
Yeah.
And when people care, they do good work. It's not complicated.
Yeah.
It's really not that complicated. Now, what people do often is they'll minimalize it and they'll say, oh, this is just the front desk, or, oh, this is just the back. And I always tell them, like, front of house is just as important as back of house.
Yeah.
It's just as important. And, how you respond, when you respond, et cetera, they develop relationships. And it's funny to me when people finally come in and they fly in and they'll ask for specific people. They'll be like, oh my God, is Allie here? Who's Karen? Where's Karen? Can I meet Karen? Because they've been having this relationship with these people, responding and talking to them, and they get to know them so well. And it's really cool. And I like that the staff take ownership in that, because then they get the joy and the pride of it, and it reinforces. And then when they do something cool for them, patients get excited. Then they send back that feedback. Other staff sees that. And then other staff wants to do cool stuff for patients too. So all of a sudden you get into this like feedback mechanism where everybody's trying to outdo everybody else to provide even better service because everybody wants that relationship with the patients. And then
Right.
it really does feel like a family, which is what's cool.
I feel like that's almost a lesson just in any business, you know, what
In
you're,
general.
you're saying now, it's like this beautiful circle of like kindness, love, you know, care. And yeah, it's a good lesson for, I think, any business.
For anything.
Yeah.
But I think the hard part is, and this is where I struggle with personally, is I'm not going to force you to do it. Like, I'm not going to force you to do it. And
I don't think you can force that.
Some people try.
Yeah.
Some people try. And for me, I think that a lot of the staff see that, like, I wake up earlier than everybody else. I go to the gym. I'm there before anybody's at the office.
Yeah.
I'm there after everybody's gone. I don't take a lunch. I work throughout the entire time. If my staff is hungry,
How
I'll give them
American
lunch.
of you.
Yeah, exactly, right? It's like, yes.
I don't take a lunch.
I don't take a lunch. And it, don't take a lunch. I stay after hours. I do everything.
Yeah.
If my staff is hungry, I'll buy them lunch. I'll take care of that. I take them out to dinners. I do all these things. And so they kind of see that like their work is appreciated.
Mm-hmm.
And then they say, well, he's working like this, then I can do it too. But as long as I'm appreciated for it and acknowledged by it, it makes sense. But I'm not going to force you to because it's not your job to do that. But if you do that, it gets recognized and, tell you like, listen, you're doing a great job, by the way, you don't have to do this. Like, it's my job. I own the place. I have to stay here.
Right.
Go home. And then when they tell you, no, I don't want to go home. Like, I'm not leaving you by yourself. Like, that's kind of cool. Like, then you realize like, okay,
Absolutely.
like
yeah.
you're taking ownership over
Yeah.
this. Like, that's awesome.
This is awesome. Just as a side note, but you mentioned I mentioned the American work ethic or whatever, Canadian. I was talking to a friend of mine. She lives in Paris. And I come from the corporate world environment. And she was telling me, it was a couple of years ago, I had just quit my corporate career, so to speak. And I met her in Paris and we were sitting having dinner. And she's like, I'm so tired. I worked 35 hours this week. I was like, wait, like, okay. Wait,
Yeah.
that's a lot for you?
Yeah.
She's like, yeah, that's overtime. Like I'm so exhausted. Like, I'm not going to tell you how I worked like 50 before.
Yeah. No, it's crazy. And not that what we do is right.
No.
In any sense of the way.
I'm not saying it is.
Yeah, I don't want people to think like, oh my goodness, like you have to wake up at 4:30 in the morning and go to the gym and work 12-hour days. Like, if I could avoid doing that,
Right.
I would absolutely avoid doing that.
Yeah.
It's just a matter of finding like what works for you, really. And I think that's probably the hardest balance is, especially with like physician burnout and like corporate burnout. And I'm sure your husband talks about it too in law. I mean, it's very easy to get burnt out.
Yeah.
And you just have to be aware of what you can do and what you can't do more than anything. I mean, for me, there's end goals in place. I mean, I work really hard 4 days a week. My Fridays are half days. Every other Friday I do surgery, but I'll only do like half day of surgery. So it's not too bad. That's how I rationalize it in my head anyway. But I'm not, these guys in New York or LA that are cranking out all day, every day, Monday to Saturday. Just not going to do that.
Right.
Like, I think quality goes down. I think you stop caring. I think you become jaded. And the second the quality goes down and you stop caring,
Yeah.
then why are you even doing it? It doesn't matter if you're making bread or you're doing surgery.
Right.
It's still the same thing.
Yeah. Do you do rhinoplasties?
Mm-hmm.
Yeah. So let's actually, before we go to rhinoplasties, I want to talk to you about specifically facelifts.
Okay.
So you know how before, like, I don't know, early 2000s, you would look at pictures of facelifts and it would look like ridiculous. Like,
Yeah.
just like, there's like a picture of this famous lady who, like, if you Google plastic surgery gone wrong or like fillers gone wrong, her face shows up. I don't know what happened there. Actually, I'd be curious to know. Like, I want to try to find her picture. But I wanted to ask you, your facial, or the pictures of your work look very natural. Do you mind walking me through, like, how does it even work?
Yeah,
when
easy.
you
So,
lift the face? Like,
yeah, super easy. So you have to think about the history of facelifts.
yeah.
All of this, historically, a facelift was called a iridectomy. So the medical term is iridectomy. literally meaning you are removing the rhytids, and those are the wrinkles. So historically was, let's just kind of remove the skin, lift the skin, pull it really tight, and set it back down. That worked. Just kind of left you pulled and looking a little funky and weird, but
It was like a little, you looked a little too surprised,
little too crazy, you know?
I have to
And
find this
then
picture,
slowly they started to think like, okay, maybe we need to lift the muscle. And so then we discovered the SMAS layer. And so the SMAS is a layer that's under the skin that's above the deep lying muscles. And so you're able to lift that up and tighten it up. And so then you did what's called a SMAS lift. Great lift, by the way, because that is actually supporting the skin as it comes up. Now, the problem with those lifts is that they were being horizontal. So they were pulled backwards. And what you'd end up seeing is that, number one, they wouldn't address the midface. They would just address the area below. So they were called lower face and neck lifts. Number two, they're pulling backwards. Nobody ages forwards. You don't need to be pulled backwards. So yes, you were pulling, exactly, you're pulling the jowl along the vector of the mandible. So people thought like, oh, this is good because I'm going like this. But all you're doing is you're taking the corner of the mouth and you're pulling it out.
This is so funny. They were just like, let's try this. Let's pull it backwards.
Correct.
It's not working very well. Let's try something else, right?
Basically, that's basically what it was. And so, 5, 6, 7 years of that went by. And then like, okay, well, that's not working so well. And then they kept advancing and they're like, okay, we got to change the vector and moving. And eventually we got to the idea that things need to be lifted vertically or a little bit more vertical. Now, not everyone needs to be lifted vertically. So how do you determine what angle? True vertical lifts are unnatural as well. So 90 degrees is not natural. 0 degrees is not natural. Right. The truth is that there's some elasticity in the skin. So yeah, some things do fall straight down, but also things kind of fall forward because they're following the track of the muscles. Where do the muscles attach? On the cheekbone. So a good way of realizing kind of where you'll be is if you corner the mouth to the cheekbone area. So that's kind of the angle most people you're going to be going for, and that gives you the most natural result. Problem, because so far it seems pretty easy. Why doesn't everybody just do that?
I mean, to be honest with you, it seems really complicated and hard, but sure, yes.
Yeah. So there's actually, the biggest problem is there's a ligament right here. So if you take your face and you move it right around here, you can feel that there's a little area that doesn't want to move. So this is called the Meyer's patch. It's a ligament that's right in your midface. So this actually supports your midface. As we get older, it gets a little bit more relaxed, kind of starts to come down. But you need to release this ligament. When you release that ligament, you can pick it up and put it wherever you want. Downside, it's really tenacious to go through there. A lot of nerves that control the face go through there. So you can injure the nerve. You can have issues with movement. You can leave paralysis to the face. So if you're not comfortable with what you're doing, you're going to say, I'm just going to kind of release it, just loosen it up a little bit and tighten it up. But you can't go upwards. You got to still pull backwards. And so historically, what a lot of people were doing is they're just lifting and pulling back. And when you pulled back, you got that windswept look. Things look strange. So this area was pulled backwards. The neck was pulled upwards. You'd get these crazy little pixie ears where the earlobe connected all the way to the mandible, coming straight down. Just really bad ideas all around.
Right.
And so then you'd get this bunching here. So then you'd have to make this incision up here to pick this up vertically, which would pick up. So you're making up for deficiencies in the technique, right?
Okay.
So all of a sudden you're making a mistake here. And people still did it because it was the next best thing.
Right.
So then eventually we realized, okay, you have to do a little bit more releasing. And this is where things get a little jazzy, where once you release the entirety of the ligaments and you can put the face wherever you want,
you can put the face wherever
you want. And so as you're positioning it, you have to look from both sides to see what needs to go in what area, to make sure that the lid cheek junction's right, things look good. When they're smiling, things are gonna sit right. They don't get any weird bunching. And that's where it gets a little jazzy. And then the back, same thing. You're anchoring upwards to pick this area up after you've freed it. So everything's getting redraped in an upward vector. But then you have to redrape the angle of the mandible. So then that one you wanna kind of anchor behind the ear after you've created a sling and you've cleaned up the middle and done a whole bunch of other stuff. So very quickly, you're kind of advanced.
Holy, Dr. Mascaro, you're like opening up a whole world to me because I, in my non-medical knowledge of the situation, I thought, okay, facelift, they just probably like pull. I mean, I've never watched, I've watched a rhinoplasty before, like getting a rhinoplasty, right? But a facelift, to me, it makes sense that they just like pull something backwards and that's it.
Yeah,
but
there's like
this whole,
You got to lift a lot. And that's the biggest argument against threads, right? Because anybody who's done facelifts, Anybody who's seen a facelift
Ooh, I
will
would
tell you.
love to hear your arguments against threads.
We'll tell you. One fucking thread is not going to do shit. Like I have to do 2 hours of work on each side of the face, freeing up each ligament to get things to come up and sit there. You're telling me you're going to put one thread pull up, and what are you going to do with the excess skin? It's going to bunch up somewhere. So there is a time and a place for threads, just like anything else. I'm very much against absolutes.
Okay.
So if you were to tell me absolutely never do this, I'm going to tell you, well, no, there's probably a time when it fits. It's just not the right thing for everybody, right? So once you have excess skin, guess what? It's got to go somewhere. You got to cut it out. When you have a little bit of laxity and you just have a little descent, it's going to help. It's not going to be what you want. It's not a full lift, but it looks pretty natural, looks pretty good. And so, yeah, it's big surgery. That's the biggest argument I have with patients is I'm always amazed after everything that we do surgically for, skin to skin takes me 3.5 hours to 3 hours and 45 minutes to do a facelift, just straight facelift.
Wow.
I'm amazed that we do that. And then in the recovery room, they're moving their face, smiling, laughing like nothing happened because we literally take their face apart and put it back together. So every time patients come in,
this is so fascinating.
So every time someone afterwards comes in and it's like day 6 and they're like, ugh, I'm a little swollen, I'm a little itchy or it feels a little tight. I always look at them and I'm like, do you realize what we just did? Like you got in a knife fight with me and you lost. like it's gonna take a little bit of time to heal. Like when you twist your ankle, you gotta give it like 3 weeks. And that's a twisted ankle. I was like,
be grateful it's just itchiness.
Yeah, I opened up your face. Like
Wow.
relax. It's gonna take time. It's gonna look good. You gotta trust the process.
Yeah.
But yeah, you gotta give yourself some time.
So it takes around 3 hours, you said?
For me, skin to skin, 3.5 hours. And so what that
That's
means,
like for full face.
so that involves opening up the center of the neck, opening the platysmal veins, the little veins that come from the side, opening them up, cleaning the bottom, taking the glands out, tightening it back up, opening the sides, freeing it down to the nasolabials, all the way down to the neck, cleaning out the neck, rotating the muscle, anchoring it behind, then redraping everything upwards, tailoring the skin around, making sure everything's pristine and just looking perfect. 3.5 hours to 3:45.
Just a normal Tuesday afternoon.
Yes.
Yeah. Wow. Can you do okay? The first question that I have for you actually is you mentioned something related to wrinkles. If you do a facelift, does it remove your wrinkles? And do you still need to get Botox done?
It'll remove some wrinkles.
Yeah.
It won't remove all of them. There's 2 types of wrinkles. There's dynamic wrinkles, and then there's static wrinkles. Static wrinkles, it'll get rid of. So those fine lines that you're getting through here, especially when you're smiling and you see kind of just bulging up of skin, it'll take care of that, no problem. Dynamic wrinkles along the eye through here, that when you smile, and I got my Botox in now, so you can see it, but when you smile,
I just got mine.
yeah, when you smile, those are there.
Right.
So you won't get rid of those. But you will see a big, big improvement with the nasolabial folds, with everything that's redraping. It's almost like you're taking a big, heavy carpet that's bunched up, just picking it up and stretching it out. That's what you're doing. So yeah, if the carpet's moving, then yeah, there's going to be wrinkles in that carpet. But the areas that are static, those are going to be fine. Now, to jump into that, and the follow-up question that usually people have is, okay, well, if a facelift gets rid of wrinkles, does a brow lift get rid of wrinkles? Brow lift does not get rid of wrinkles. So that is where the medical terminology is different. So a facelift is a rididectomy, gets rid of wrinkles. A brow lift is not a rididectomy. A brow lift is literally, we lift the brows. And so there's one particular technique that helps with some of the brows, but doesn't get rid of all of them. And that's when you actually make the cut along here and you're cutting some of the muscle. But otherwise, the only place where you can help with the brows, with the wrinkles, is across the midline here and a little bit along the side here. And that can actually release some of that muscle. So when you do a brow lift, you get less wrinkles. But anybody who's had a C-section or abdominal surgery can tell you, they can cut your tummy all you want. You can still do sit-ups afterwards. So even though we're cutting these muscles, you'll still be able to move them. If you can move them, you can make wrinkles.
Right. That's fair. And for a brow lift, you just work with this area, basically where your forehead is. And
Couple different brow lifts. So it depends on what you need. Historically, 5 different types of brow lifts. Okay. So the first one is the old school, coronal. What does that mean? It goes from ear to ear, just all the way across. Why would anybody do that? Well, we did it in trauma because if we need exposure, we need to be able to peel forward and we need to be able to peel back. Cosmetically, why would you do that? If you've got a really short forehead and you want to make it a little bit bigger. So you're actually pulling the hairline back. So I'm sure most people are thinking and saying, why would anybody want a bigger forehead? Trust me, there are people out there that want a slightly bigger forehead. So that would be a reason to do it. The other one, now let's say, okay, well, we're not going to be doing a big cut from side to side. We don't want to make the forehead bigger every time. We do a trichophytic. So we start here and then we go along the hairline. Advantage there. The incision allows the hair to grow through it, so it hides it within the incision, number one. Number two, if we want to slide the hairline forward, we can actually make the forehead shorter as we pick the brows up. So that's a very common. That's a little bit more modern from a coronal, and people do it, but not a lot of people will do a hairline advancement at the same time. But that's another option. Third option, you're a guy, you're bald, you got big ass wrinkles across your forehead. You just hide in one of those forehead wrinkles. Now, is that something that is done very commonly? No, like I said, bald, big lines, like it has to fit the criteria, right? And even then, it's most guys now, they're all do. If you're coming in for a brow lift, you're probably doing Botox. You probably don't have these. So it's very, very limited. But again, that's another technique that's very commonly, or not commonly used, but that is used. And then you get to the two other ones that are commonly used. A direct brow lift, where you do it right over the brow, and then an endoscopic brow lift. Why would you do a direct brow lift? Gross asymmetry, right? So there are patients where they just have one brow that's super wonky, and that's just the way the good Lord made them. And so you won't be able to address that asymmetry up here because it's too high when you're picking it up. So you have to cut right on the brow and pick it up. Hides super well.
It hides super well. This card.
Super well.
And even here, like you don't, I mean, I have some friends who you don't see it.
Don't see it.
Do you have to wait for hair to grow over it or?
Yeah, usually. And you have to be really good with your suturing, making sure you're approximating things well, decreasing tension. So that there are some things from a technical standpoint we have to be really good about. But for the most part, they do very, very, very well. And that's where the endoscopic comes in. Now, the endoscopic brow lift is a little different than the other ones because all the other ones you're cutting stuff out and then you're bringing it up. The endoscopic brow lift, you're not really cutting anything. You're releasing. And so that is the key. When people talk about endoscopic brow lifts not working, it's not that the endoscopic brow lift is a shitty technique, is that dude just doesn't know how to fucking do it. Like that's all it comes down to. There's 3 major ligaments that are in the brow. There's your arcus that comes all the way across through here. There's your temporal ligament that comes through here, and you can feel it if you clench your teeth real tight. Feel that temporalis muscle. And then there's a forehead, the ligament that goes right through there. There's a temporal line, so your temporal ligament goes all the way across to the back. And then back here, there's an occipital ligament that covers across. So think of it like you almost got like a little hat. You got to free all those ligaments because since you're not cutting any skin, you need that scalp to slide back. If you don't release the ligaments, it's what we learned in the face, you don't release those ligaments, you can only hold this up so much before it bounces back. So that's the biggest reason endoscopic brow lifts fail, because the ligaments weren't released. And so when we come in endoscopically, we're able to see everything from below. And once we're seeing it from below, then we release all those ligaments. We see the nerves, we free them up. We release the muscles through the middle. We release the muscle on the side. And the brows just naturally come up. It's pretty wild. And so when we're done, I tell patients, I'm like, we have very little control over where we anchor the brow. But what's cool is your body's already kind of setting the brow where it naturally should be. So you're just going to that youthful brow that you used to have 15, 20, 30 years ago.
It won't go too high up?
It won't go too high up. And then, yes.
Imagine it's like, we don't really have control over how far it's going to go. But it's probably, you'll
gonna
probably be okay,
You'll be fine.
You wake
You'll be
up.
all right. Don't worry, you'll be all right. And what's cool is that once you have that freedom, then you can play with the brow. So let's say you see someone that's got a really heavy middle brow. So once we free everything up, everything's going to come up.
Most of men in my part of the world in Eastern Europe.
Exactly. So in that case, what you would do is you would actually place your anchors a little bit closer to the middle. So you place a little bit more support in the middle, which that then lifts that area up a little bit. So you've created the release, which comes up. If you imagine, the wings of a bird in flight, everything's coming up like this with the body of the bird in the middle. But then you want to pick up the middle too. So then you release the muscle a little bit more, that causes a little bit more release, and then you anchor that, holding it up. So that's when you have a little bit of play. And that's where, the details matter. Because even though you're releasing the brow and the brow's coming up and it's setting where it naturally wants to sit, you have a little bit of wiggle room and you can anchor a little bit higher here, you can anchor a little bit more here, you can give a little bit more tension here. And that's where you kind of can cantilever a little bit of that wing, how you want it to sit and how you want it to play. And that's where things get jazzy again, where it goes a little bit by feel. And that's where the discussion comes in with the patient. So if you came in and you were doing a brow lift, I'd be like, okay, Cristina, here's the middle. Here's a little mirror. let's play with your brows and see what we want. What do we want the tail to do? What do we want this to do? What do we want this to do? I like this. What do you like? Because once you determine and you figure out what it is that you like, then I can figure out what areas need more release and where we need to anchor. Because the global release, just going to keep you exactly where you are, it's just going to pick them up. But then if you want to play a little bit with the tail, okay, we'll suspend a little bit over here. Oh, we want a little bit more arch. Okay, we'll anchor up here. Oh, no, you don't want arch. You want a little bit more in the middle. Okay, we'll do tail and middle. So it comes into a little bit of play. And there's times when, you pick it up and you anchor it and you set it down and you're like, that doesn't look very fucking good, does it? So then we'll fix it and we'll arrange it and we'll make sure that it looks perfect just to get that end point.
Wow. So during the surgery, you just go, okay, this looks good. No, this doesn't.
100%.
Like you just look at it.
All the time, every time. And, brows are pretty straightforward because it's all in the design. It's like anything else. You plan your dive your plan. And you want to make sure that you have a good idea of what you're doing. So when I give you the mirror and we come up with the idea, I mentally have a good understanding of what areas need more release than others. And again, that just comes from experience. But once you do that, and then you do the plan and you anchor one, so we'll anchor one of the brows and I'll look at it and I'll say, okay, that looks good. But then when we do the other one, because guess what? Nobody's symmetric. Everybody's brows are a little funky. And so one brow may be a little bit different than the other. So what we plan once it's released, the muscles and the underlying bone structure may be sitting a little differently. So I'll anchor it, take a look at it. Most of the time I've gotten pretty good at it where I can, do it on the first try and be like, okay, looks really, really good. But once in a while you set it and you're like, I don't like this. Let me make sure it fits right. Let me make sure it looks good. Let me make sure it's perfect. So we always want to make sure that we're happy with it on the table because it's not magically going to get better afterwards. If you're not happy with it on the table, do it over again. It's got to be perfect.
Mm-hmm. How long is the recovery?
For brow lift?
For brow lift, yeah.
10 days.
That's it.
Yeah, it's not bad.
Does it hurt?
It does hurt. That's the only thing that hurts. And everything that we do, that's the only thing that hurts because we're anchoring to the muscle out here. So every time you chew, you're going to feel it in your temples for about 2 or 3 days. Now, it doesn't hurt a ton. Like on a scale of 1 to 10, it's like a 3, maybe a 4. It's an annoying headache. It's not terrible. But those don't hurt. The anchors that we put in the bone doesn't have any nerve endings, so it's fine. That doesn't hurt. It's really the clenching that hurts. 10 days, but it depends. It depends on how badly you bruise, how badly you swell. First 2-3 days, you look like an avatar. It's not cute. And then that swelling goes down. But honestly, it depends on your bruising. I mean, I have some patients that bruise like crazy. And then that just, takes about 10 days, 2 weeks to go down. I have other patients, you'd never guess they had anything done. And then they're out and about on day 4 with, little stitches and staples in place like nothing happened. So
wow.
It varies.
I was very surprised by how non-painful my nose job was.
It doesn't hurt.
It didn't hurt at all.
No.
Like you're walking around looking like it should hurt.
Yeah.
But it doesn't hurt.
It's uncomfortable.
It's uncomfortable.
And
it's ridiculously uncomfortable. Yeah.
And this is what I tell patients all the time is facial plastic surgery is not painful. It's uncomfortable. Yeah. It's inconvenient.
Yeah.
But it's not painful. The only thing that hurts is the brow lift. But that's really it. Yeah.
That's the next one on my list in
brow lift?
a few years. Yeah, I think.
Yeah, but you'll be fine. You got time.
Yeah.
You got time.
I think I'm okay for now. But yeah, the nose surgery, I had a complication with it. My bone started healing to the side.
People don't realize that. This is the tricky part about noses. Is with a nose, you're taking a 3-dimensional structure in the middle of the face that's attached to just about every mimetic muscle of the face. And you break it down, then you put it back together.
With a hammer, literally.
Literally,
right?
yeah. You break it, then you put it back together, and then you say, don't move for 6 weeks.
Yeah.
Because it does take about 6 weeks for little bones to heal.
Yeah.
So little things like sleeping too much on one side can start putting a little bit of pressure on that bone and can start moving a little bit, can start shifting. And if you don't catch it early enough, then you're kind of screwed. You got to re-break it and put it back in place.
Yeah. I had, I did it in Calgary and she basically so I was trying to be inconspicuous at work. Not that I was hiding it, but I was still working in the corporate and I was like, this is great. I'm taking time off work for a medical reason. Nobody has to know really why. If somebody asks, I'll tell them, but
right.
I'm not gonna go around and be like, I'm getting a nose job. And I went to, I got my surgery. I had my cast for 1 week. Then I went to see her. She noticed that the bone was healing to the side. She pushed it in place, which hurt
like a
bitch. Yep. That hurt. That was the only part that hurt.
Yeah.
But it was only about 5 minutes, so it wasn't too bad. She put it back into place and she's like, we're putting the cast back on for another week and then you're done. We did it. And then after that, I was scheduled to go back to work. I go back to work 3 days later. I look at myself in the mirror and I'm like, this isn't straight. So I call her and she's like, immediately come into my office.
Yeah, you got to do it as soon as possible.
I go in, she pushes it back in again. She's like, it's just for some reason, it doesn't want to be back. It doesn't want to be healing the way it's supposed to be healing. So she does it again. And I come back into work all inconspicuous with a cast on my nose. And I'm like, hello, everyone. Yeah. But it healed well after a while, but something grew over my bone.
Yeah, it's just a little.
So I'm going to get it removed.
Yeah, just
the
shave it down.
Dorsal rasping, I think it's called.
Yeah, just shave it down.
Yeah. It's not supposed to be super, super bad.
No, that's easy.
Yeah.
Yeah, that's easy. Yeah. But yeah, that's exactly. So that harps to two things we were talking about earlier. You felt comfortable enough to call your doctor right away, right? Put out the smoke before it becomes a fire.
Yeah.
She was good enough to say, I don't care what the hell I'm doing. Come in right now. I need to fix this right away because the more we wait, the harder it gets and the least likely it is to fix. Yeah. And sometimes shit happens.
Yeah.
But as long as you take care of it, it's fine. And then, you have a little dorsal rasping here, whatever. Like, this is a thing that like bothers you, but average Joe on the street has no idea.
Nobody can tell for sure. But it comes back again to what you were saying. It's like, I've been staring at my nose ever since I got it done. Like 100%. Every day, just like, that's all I see sometimes in the mirror, just because I got it done, right? So,
It's so common. I mean, that's the most common question I get. So for example, for lip lifts, they'll say, will I see the scar?
Lip lift? Like it's...
So when we make a little cut under the nose and we pick things up and roll the lip upward, improve the facial proportion, give a little bit more volume. Super cute. Looks really, really good.
Is that sort of instead of a filler? Or?
Kind of. Not instead of filler, but it gets you a better facial proportion. So it makes you look a little bit younger, right? So it gets you a really cute short philtrum. Now, people always ask me like, oh my God, I'm afraid of the scar. Am I going to scar? I tell them, well, 3 things. 1, from a surgical standpoint, you're going to have a pencil thin line that's hard to see. Even with stitches in place, don't worry about that. I got you. 2, taking care of it, you're paranoid about scarring. So I'm not worried about you doing something stupid to it. So I know you'll take care of it. We'll give you the instructions. We'll give you the scar cream. The one thing we don't have any control over, the genetics of the tissue. So guess what? If you were going to do surgery and like you always scar, you're going to have a scar. It doesn't matter what I do. Doesn't matter what you do. Like same thing as me. If I did a surgery and I did some sort of surgery, like I'm going to scar. I heal terribly. I know I'm going to get a scar. So whatever. But here's the thing. Even if I leave you with a pencil thin line and everything heals perfectly, you'll always know it's there.
Yeah.
Because you had surgery and you'll be staring at it and you will forever think that everybody's staring at it. And here's the thing. Nobody knows that you had it done.
Yeah.
But you think about it.
Of course.
And so I tell people you need to be comfortable with the idea that you are going to think everybody's staring at this thing,
You almost attract questions then, like it almost feels like people... I don't know. You attract people asking you about that stuff when you're so paranoid about, can people see? I mean, I'm super open about all the stuff that I have gotten done and I'll continue to be. But I feel like when you're so paranoid about, can anyone see?
Yeah.
People somehow are more likely even to notice.
They'll ask you. They'll say like, what's wrong? If you're like, oh my God, like, does my nose look okay in that picture? They'll say, why would your nose not look okay in that picture? It looked okay to me. Is there something I should be looking for in your nose? Same thing. Like, oh my God, are my eyes... My eyes look good in that picture. Your eyes look the same as they always did. There's something that they should be looking different. Like what's going on?
Yeah.
Then that makes you more paranoid.
Yeah.
And then you're like, oh, nothing.
Yeah.
And like, no, tell me. Like what's going on? And then it becomes a thing.
Yeah, for sure. What is the deal with $100,000 facelift that?
Well, they're popular now. Well, not popular, but they happen. There's $100,000, $200,000. There's one that's $500,000. And so the question that you have to ask yourself, and I'm going to give you the doctor standpoint, I'm going to give you the businessman standpoint, I'm going to give you the unbiased standpoint.
There's a Russian celebrity who like just recently went to LA and got like, allegedly, it cost like around $150,000.
Easy. So I've seen quotes from mediocre doctors, no-name doctors, people nobody's ever heard of before, charging $120,000 to $150,000 for a facelift because their practice is in LA, and they're charging even credit card fees. They charge you for a credit card fee. And I'm just like, wait, so you're charging $120,000 for a bloody facelift and you have the balls to charge a credit card fee because they're charging, like, that's insane to me, right? And so I think of it, so let me tell you, from a doctor standpoint, I think that you do have to charge what you are worth,
Right.
or what you think you're worth. And so we are in a free market. And if you determine that your worth is $650,000 and there's somebody out there that's willing to pay $650,000 because you think that you are worth $650,000, then you are free to charge whatever you want. From a business standpoint, same thing. You know, free market, if people are willing to pay $50 for a cookie and there's $5 cookies, but
Right.
people want to pay $50 for the fucking cookie, pay $50. Like, who are you to tell them no? From an unbiased standpoint, I think it's obscene. And I think it's obscene because the only reason I would ever think something is worth significantly more than what other people are doing is because it's either better or it's done better. So those two things are different, by the way. So what does that mean? Think of it, handbags, right? So if you go to Hermes, Hermes bags, like if you're buying them from your SA and you're getting like a quota bag, it's not particularly expensive, like 12,000, you know, for a Kelly, or, you know, 14 for like a Birkin, you know, like it's not crazy expensive, but you're getting craftsmanship, you're getting quality. And so that's what the aftermarket is. So the reason why these bags are hard to get is because they only make a certain number of them, and each one of them is handmade. It takes 5 years before any single person is allowed to make one. Like, there's a tradition behind it, and this is why they're expensive. Now, does that mean that you're getting better craftsmanship than if you're getting a Coach bag? Yeah, actually, the craftsmanship's much better. You know, is the leather better? Yeah, actually, Hermes is much better than all that stuff. Now, let's compare that with like a Gucci bag. You're getting a Gucci bag versus a Coach bag. They're not hand stitched, either one of them. Both made by machines. Leather's about the same. Gucci's actually cloth, not even leather most of the time. And the leather they use is not going to be the same quality as an Hermes leather. So you're just paying for a name at that point, which makes sense because, you know, Gucci's a brand and that makes sense. All right, well, not Gucci. How about YSL, or how about Bottega or Chanel? Craftsmanship's much better. Leather's much better. Now you're kind of being like, okay, it's not quite Hermes. I'm not going to pay, you know, off market 50 grand. I don't have an SA that's going to sell me a quota bag for 14, and I'm not willing to wait 2 years, but this other stuff's pretty good too. And so there's varying degrees of quality and of craftsmanship. Now let's talk about surgery. Is there craftsmanship? Is the $250,000 facelift better craftsmanship than a $50,000 facelift? Probably not. I can actually tell you, no, it's not. And there's little things that I see when I see these people that pay $200,000 or $250,000 or $300,000 for their facelifts, and I'm seeing, and I'm like, there's corners that they're cutting, and that would fucking annoy me. Like when they go around the ear, they don't follow the whole tract around the ear. They go a little bit and then they go up into the sideburn. So that seems stupid. But to me, that's a tiny detail that, guess what? If I'm paying for craftsmanship, I want the craftsmanship. I want someone to take the fucking time and do it right. Right? So craftsmanship's
It's almost
not
like
there.
almost scams.
Not scam. I wouldn't call it a scam.
Okay.
I would say at that point, you're not paying for craftsmanship. So what are you paying for? Are you paying for quality? Well, quality is going to be the same. And part of that is genetic. Unfortunately, you know, if you have someone that doesn't have great genetics, it doesn't matter. You can pay $1 million. And if you're just one of those people that doesn't have great genetics, your tissue is going to relax faster than others. If you're a 30-year-old that looks like they're 50, guess what? You do not have great genetics. I hate to say it. So then what does that mean? That means that when you're 40, yeah, you're going to look older than you would anyway, because that's what happens. Your tissue already told you that at the beginning. So not quality, because that's a big part of it. So craftsmanship's not there. Quality's not there. So at that point, you're paying for a brand.
Right.
And so then you have to realize I am paying for a brand. And a lot of these surgeries have trademarked names for them for a reason, right? Because you can't trademark surgery. You can't trademark kidney transplant. You can't trademark a hip replacement. Trademark a name though, right?
Yeah.
And so then all of a sudden you become a brand. And so now you're selling a brand. So I'm not selling a $100,000 facelift. I'm selling 100,000 flippity floppity floop lift, right? That's a different story. So now you're in branding. So then you have to ask the question is it ethical for doctors to brand surgeries and then mark up the prices for that particular brand? There's a reason why they brand them, because then they sue other doctors that say that they do a similar procedure. Because now all of a sudden dilutes the value of the brand. So they're protecting the brand. They're not protecting craftsmanship. They're not protecting quality. So is something like that worth it? Is it worth it to you? I mean, some people, you know, plenty of people, I know plenty of people that will say, I went and got this because it's the most expensive. My flex is I was able to go over there and spend the money on it. That's my flex. Doesn't matter that shit's better over there.
Right.
I mean, I know plenty of people that, you know, like, listen, if I can't get my Jordans off the stock list, which never fucking happens, I'm not going to pay $3,000 on, you know, StockX or go to get the Jordans that I want. But some people will tell you, I paid X amount of dollars off of this to get them.
They have to be able to flex. I don't know why I turned on my accent automatically. I just had to turn on.
Because you need to flex. And you know that. Like, there's some people that just want to flex.
Yeah.
And they'll be able to say, hey, I did this. And there's many people that you'll see that do these multiple $100,000 lifts. And you're like, I don't know if I'd be happy paying that much money and this is the result you got. Like, what were you expecting, you know?
So it is a little bit unethical, right?
I don't know if I would say I would question it.
Yeah.
I would question
Maybe
it.
more so even the moral aspect
I would say the moral
of it.
aspect of it,
Yeah. Because it's not necessarily that they're doing a bad job.
Correct.
Right?
They're not doing a bad surgery.
Yeah.
They're not doing a bad job.
Yeah.
They think they're worth that much.
Right.
So...
And people are willing to pay.
And people are willing to pay it, which validates that.
Right.
So is that the thing? Yeah. Could you go somewhere else and get a much better value and get better work? Sure. Of course.
What's the average price of like a full facelift in this area?
This area is different. So Florida is a little different than LA, New York, Chicago, Texas. I say Florida is a little bit closer to Middle America because we compete with South America. So that's something that other people don't have. So we're not competing with New York. We're not competing with LA. We're competing with Colombia. So it's a little bit different pricing. In general, decent surgeon, you're going to look at about all in 35,000 for a facelift. That includes anesthesia, facility, et cetera, et cetera, et cetera. You can get some discounted places for like 10 to 15, but like, I don't know.
That's starting to be a little bit more.
I think that's suspicious in the States in general. Whereas, you know, New York, you're looking at 60, 70 average. Texas, 50s. Chicago, 60s. LA, 90.
Hundreds of thousands.
90, no, I'm serious. I legitimately got sent a quote from one of my patients from a guy I've never heard of before in my life. He's actually a boob guy. I looked him up. He does mostly boobs. Very rarely does any facelifts. $130,000.
Oh, wow.
With a credit card fee.
Damn.
I'm like, this is crazy. You know, but people do it.
You do solely facial.
Just face.
Yeah. So it's more specialized.
Yeah. You don't want to go to the boob guy for your noses, you know? Like,
yeah. That
just go to the face guy.
kind of makes sense, not going to lie.
Yeah.
Two things. We're almost at our time here. So first, I finally found the picture. And I don't know what happened exactly. I think it was something related to fillers and facelift, but have you seen?
Yeah, all sorts of terrible things.
Yeah.
So that's a combination of bad ideas. And so when that happens,
I don't know if
and
we'll
so
be
for
able to eventually
so
zoom
for the
in.
people that are just listening, I don't want to say your name, but if you look it up, it's exactly as Cristina said. If you just look up bad plastic surgery or Catwoman plastic surgery, you'll see it. It's a combination of things, and usually this is what happens when you just focus on the micro and you don't focus on the macro.
Right.
What does that mean? And a conversation I have with patients daily is, yes, there may be a hollowness here. Yes, this may have fallen. Take a step back, look at your full face. If we start dealing with tiny little things that we're changing, before we know it, we've changed your entire face. And then all of a sudden, now we're playing catch up and we're chasing this dragon, trying to fix it. And so, oh, my cheeks are falling. Let's fill up the cheeks. Okay, cheeks are big up front. Well, now the sides look weird when I smile, so now you fill up the sides.
Ah,
and
okay.
then,
So it's
now
a
my
game
temples
of
look weird. Oh, temples look weird. We got to fill the temples. Well, now this looks off. Oh, well, now we got to actually cut it out and pick it up. Well, now this is a little strange. Okay, well, now you got to fill over here. Before you know it, you're chasing your tail. And when you take a look and realize that not everybody can look the same, not everybody has the same bone structure, you have to embrace your own aesthetic and embrace what makes you you and embrace what makes you pretty, then you'll be fine. It's not about making things better. It's about subtracting the things that take away from your natural beauty. That's all it is.
I see. So just overdid it in all different ways.
Yeah, many ways.
Right.
Many
Yeah,
ways.
it's something I remember, of course, when I first, my family was super against all that stuff, but when I first talked about any kind of invasive procedure, let's put it that way, that was like the first thing that comes up. Like you Google it. And
everybody's
just,
afraid, man. Everybody's afraid of that.
Yeah.
And it's so common.
But then you do it and you're like, oh, this was not bad at all.
And that's the problem.
And then you have to be careful with like, okay, let's not go too far.
Exactly, because then you get bit by the bug.
Dr. Mascaro, I want to ask one final thing. What about, and what is your opinion on facial fitness and all the accounts you see these days of like massaging, gua sha, and all of that stuff?
So two things. So facial exercises are stupid. That's dumb.
Oh, wow. That's just like
Dumb.
that. Hey, okay.
Dumb,
I love the
dumb,
bluntness.
Yeah, dumb.
Tell me
move on.
more.
That's stupid. Dumb. Retarded. But the gua sha, that's really good.
Yeah?
That works really well. So there's a lot of science behind that. And basically what you're doing is you're stimulating and releasing some of the lymphatic flow off your face. So you're moving and kind of getting rid of a lot of the stagnant lymphatic fluid. And so you can really shape the face significantly, the same way that you can shape the body if you're doing significant lymphatic flow. It's super important after surgery because we see that you do need that lymphatic treatment. Now, after, as far as maintenance is concerned, it helps. It's not going to help shape the face long term, but it will improve some of the contouring, jawline, cheekbone.
So it actually will improve that,
Absolutely.
Hey? Oh, wow.
Yeah.
Okay.
No, that works. That stuff works. Yeah, yeah.
Wow.
Now, is it a long-term fix? Like if you do this for 20 years, are you going to look like you're 25? No. Aging process continues. Biology of the tissue is going to be the biology of the tissue, but it does work. Yeah, especially, listen, anybody that goes out drinking, partying, and brickle one day, and then the next day they wake up and they just take care of it, you'll see it within hours.
I have a friend who's really into that. She is, kind of like a hippie, I would say, in her own way. Not quite like at that level.
Not
but
super crunchy, but getting there.
She's like really all natural. I don't want Botox. She's trying to preserve herself in a natural way as much as she can, so to speak. And she's super into that. And she looks great. She never has any puffiness, nothing.
Yeah. It moves the lymphatic flow from the face. It works very well.
Yeah.
Very, very well. Now you need to know what you're doing.
Right.
And I'm sure that, anybody who's experienced will tell you there's a lot more than just rubbing the gua sha stone like along the jawline. There's certain pressure points you need to do. There's certain movements you have to do to kind of get that flow moving out of the way. But it works. It really does.
Okay, good to know. Thank you so much.
No problem.
And thank you for your time. I appreciate it. How can people find you? We'll link everything, but just for those who are listening.
Easiest way to find me, Instagram. So at Dr. Mascaro, it's the easiest way. Then my website, miguelmascaromd.com. Easy way to find me as well.
Perfect. Thank you. I
No
appreciate
problem.
your time.
My pleasure.
And thank you to our wonderful listeners for tuning into this episode. I will see you next week.